So my name is Anthony Chalmers. I'm the Professor of Clinical Oncology here at the University of Glasgow, also at the Beatson, West of Scotland Cancer Centre. I actually came to research quite late in my career, so I was training as a clinical oncologist and didn't really think I was going to be a researcher. But as I was going through my training and started treating patients with radiotherapy, really started to wonder, why are some of these patients being cured and why are others not? And really, I think that's when I started to get excited about research, because it felt that I could really make a difference. So this radiotherapy research infrastructure grant has been absolutely key to everything that we're doing. The most important thing that it does is that it enables us to employ absolutely brilliant clinical trials radiographers there's two post Donna and Chloe, and between them they've absolutely transformed the way that we conduct our clinical trials. They've increased the number of trials of radiotherapy that are open to cancer patients in Glasgow, and they've also helped us increase the number of patients that we recruit to those trials. And that's on a backdrop of it getting more and more difficult to open trials, more bureaucracy, more costs. So really, without this funding, we wouldn't be able to open anywhere near the number of trials that we do. Trials I can maybe pick out. So we're doing one trial called the Systems 2 trial, and that's looking at giving a higher dose of radiotherapy to patients with mesothelioma, which is quite a rare cancer, but it's very common in the west of Scotland because it's associated with asbestos exposure. So our shipbuilding history makes us actually the highest incidence in the world of this type of cancer, and it's very difficult to treat. So we've actually completed recruitment to that trial, and we're quite excited because some of the early results suggest that there may be a benefit from this higher dose of radiotherapy. And that's also important because the reason we can give this higher dose safely is because of the new developments in radiotherapy technology, which enable us to target cancers much more accurately. So if this turns out to be true, then this will be a really important evidence that new radiotherapy techniques can actually help patients live longer, even with these really difficult to treat cancers. The other areas that we're interested in are using modern radiotherapy, but combining it with new molecular targeted drugs. It's a particular area of interest for me. So we've got 2 or 3 studies open for patients with glioblastoma, which is the most common brain tumour. And we're combining radiotherapy with new drugs to make radiotherapy more effective. We know already that it's safe to combine the drug with radiotherapy. So what we need to see now is whether that helps patients live longer and also live better. It's incredibly exciting. We've got so many things to use, like the radiotherapy technology, better imaging technology, like our MRI scanner, which we now have a dedicated scanner in our own department that we can use for research. We have all these new drugs coming out, and I think it's a question of using them in the right combinations, but also making sure that every individual patient gets the treatment or combination of treatments that is the best one for them. At the moment, we treat people often according to the type of cancer that they have, even though we know that that's not always going to be effective for some patients. The hope is that before we start a patient's treatment, we'll be able to predict which treatments they're going to benefit from and which ones they're not going to benefit from. So we make sure each patient gets the best treatment for them.